We are still on verdict watch in Plymouth, Massachusetts. That is where the fate of a mother accused of killing her 3 children lies with a jury. They've been deliberating for more than 3 hours now, but the jury was just sent home. Clancy's future, though, comes down to their decision. CBS News correspondent Bradley Blackburn has the latest.
In his closing argument, defense attorney Kevin Reddington derided the mental health care that Lindsay Clancy received in the months before she killed her 3 children in January of 2023.
How does this turn into this? How? Because of the damn medicine and the lousy medical care that she got.
Reddington listed many of the medications Clancy had been prescribed by different doctors.
Diazepam, Creatapam, it goes on and on and on and on and on.
He also mocked some of the evidence the prosecution presented.
Oh, smoking gun. Good moms have scary thoughts. We're going to put this in a plastic bag. We're going to show it to a jury so they know that this young lady had scary thoughts.
Clancy has not denied she killed her children. Instead, her defense claims she was suffering from postpartum psychosis and a voice compelled her to act. Prosecutor Jennifer Sprague countered in her own closing argument.
You know that she knew the difference between right and wrong during that time because she had those thoughts at the beginning of December of harming her kids. And she told Patrick and her mother about them.
On the day of the killing, Sprague said Clancy sent her husband on extra errands to give her more time to carry out her crimes.
She left them discarded on the basement floor like broken toys because she was done playing the game.
Jurors have several options for a verdict: first-degree murder, second-degree murder, manslaughter, not guilty, and not guilty by lack of criminal responsibility. Bradley Blackburn, CBS News.
Now, this murder trial has put the mental health of new mothers in the spotlight. So I want to bring in Dr. Jennifer Payne from the University of Virginia's Psychiatry and Neurobehavioral Sciences Department. Dr. Payne, thank you so much for your time today. So let's start with an overall discussion about postpartum depression, because according to the National Institutes of Health, 1 in 5 women experience mood and anxiety disorders after childbirth. So what is postpartum depression, and what is postpartum psychosis? Can you help us understand the difference between the two?
Absolutely. So postpartum depression is simply a major depressive episode that occurs in the immediate postpartum time period. It is actually one of the most common complications of childbirth. And it is like any other major depressive episode, except that it's occurring in the immediate postpartum time period. In contrast, postpartum psychosis is really rare. It occurs in about 0.1 to 0.2% of pregnancies, and it really consists of 3 different symptom profiles. One is a mood disturbance. So women can present with depression, but they often present with manic symptoms or an elevated mood or mixed symptomatology between depression and mania. The second component is psychotic symptoms, so having hallucinations or delusions. And then the third component is really a delirium-like presentation, meaning that those symptoms wax and wane and are accompanied by some disorganization and some confusion in one's thinking. And when you put all 3 of those together, that is what constitutes postpartum psychosis.
Wow. So how can you tell the difference between someone who's just having normal struggles that come with motherhood and someone who's dealing with postpartum depression?
So the biggest difference is an impairment in functioning. So all psychiatric disorders really cause impairment in functioning. So everybody's been sad or down or struggling with something, but if they can go on with their life and work and take care of things, it is unlikely to meet criteria for a psychiatric disorder.
So are there any early indicators or even tests that you can do to identify women who may experience postpartum depression or postpartum psychosis?
So for postpartum depression, right now we do screening, which is usually via a self-report form. So there are limitations to that. Other screening things that can be asked are, do you have a personal history of a mood disorder? Do you have a family history of postpartum depression? Have you had a previous postpartum depression? For postpartum psychosis, The primary screening we can do, and this is not indicative that someone will definitely develop postpartum psychosis, but is there a family history of bipolar disorder or a family history of postpartum psychosis?
And so I think with this trial, this Lindsay Clancy trial, a lot of people seem to have a lot of opinion, people who probably never even heard of any of these terms before. So let's talk about how you can actually help women who are experiencing postpartum depression. What resources are there, and should there be more research done about this?
There definitely needs to be more research. I do primarily research at this point, and I'm trying to develop a blood test that's predictive of postpartum depression. In terms of resources, there are a number. Many states have call lines, and there's a national call line that family members and potential patients can call. Postpartum Support International has a consultation service to providers to help advise them how to handle postpartum mood disorders and other psychiatric symptoms. So there are resources, but we really need more education and research around maternal mental health.
We definitely do. Always important to have this conversation. Dr. Jennifer Payne, thank you for your insight. Thank you.
Thank you.